So I'm going to talk about my top 5 pieces of advice to avoid workplace burnout. Quite a few of you talked about burnout in Module 3 with the clinical interviews. So I wanted to circle back and make sure we discuss that for this last section. And burnout doesn't only affect PTs or PTAs, it can affect all professions, but at least what I've been seeing, it can really impact a lot of healthcare workers. Now, the American Psychological Association defines workplace burnout as an occupation-related syndrome resulting from chronic workplace stress that has not been successfully managed. So, I think of burnout as a lack of desire to go to work and feeling extra stressed or unmotivated to do some things after work too. So the first thing you can do is to choose an area that you're passionate about. So if you're interested in sports medicine like I was, try to go into a career that involves that in some capacity. For me, I'm always reading, watching videos, or taking continuing education courses related to sports medicine because it's something I enjoy learning about. And that keeps me extra motivated to see those patients or work in that environment. The second thing is going to be to evaluate the culture of your work. So really look and see, are you working at somewhere where people want to have fun? Are they motivated? Are people more quiet, reserved? Is there a really punch in, punch out mentality where they just go to work, don't really communicate with anyone, and then just go home, right? So you want to also look for a place where maybe there's some mentorship, someone that you can learn from with more experience, someone that you can look up to. And also really try to prioritize healthy relationships with your coworkers. So maybe set up a time where people go to a restaurant after work a couple times a year. See if people are interested in joining like a volleyball league or go watch a movie after work. Something that you can connect with people that you spend a lot of time with in ways that are not just related to your day-to-day work. A good way you can help determine that is to remember that when you go in for an interview, that interview is important not just for the employer, but for you to learn, is that employer going to provide the best environment for you? So number 3 is looking at how many patients are you going to see per day. And this kind of relates with number 2 a little bit, but I think top 5 reasons sounds better than top 4 reasons for preventing burnout. So this is more related for PTs and PTAs, but it can definitely apply to other healthcare professionals. Now, asking how many patients you would be seeing a day is very important for an interview and really track for the trends of the clinic that you're seeing once you actually start working there. And this will vary from place to place, but from my experience and what I've been seeing, it's very common for someone in the acute care setting or subacute for rehab to see about 8 patients a day. For home health, you're looking at seeing 6 to 8 people per day because that travel time in between visits. And then outpatient, looking about 11 patients per day. That's what I've always been kind of treating with. That's about 30-minute schedule blocks. Someone comes in every 30 minutes and then leaving about hour chunk frames for the initial evaluation. So when I Googled how many patients do physical therapists see a day for outpatient, I was not really surprised to see, but they said about 12 to 16 people per day. And I know that there's a lot of clinics that really book heavily, and you're kind of forced to see a lot of people and you can't spend as much one-on-one time with them or even address them address them the best you can. So if you are looking into different places to work, really try to figure that out and see, does that caseload does that sound like it's going to be a good fit for you and something that you can provide good care to those patients? The fourth piece of advice is to prioritize self-care. So really make sure that you're spending a lot of time doing your hobbies that you enjoy. Spend time with family. Set aside time after work, and then make sure that you're setting a boundary for your work, so that way that time is not impeding into things that you enjoy doing when it doesn't have to. So if you're scheduled to see so many people in this time frame, and then you have to spend a lot of time doing extra paperwork, or you're being asked to do some things that is not part of your job description, make you stay later, really kind of evaluate that. See, is there something that can be changed? Make time, make sure you're scheduling time off, and really setting things to look forward to throughout the year. And that way you're spending time like traveling or doing hobbies that you enjoy. So that way you can really reset and have a good work-life balance. The last thing, number 5, for my last piece of advice, is to pay off student loans. Now, student loans are very common, and sometimes we have to do student loans in order to achieve our goal. But really look at, once you're done, really look at creating a budget so that way you can manage your money the most. If you are living paycheck to paycheck, your job, I guarantee, is going to feel so much extra stress, and that dollar per hour that you're making is going to feel that much less. Remember that once you pay off student loans, or the sooner that your loans are paid off, the sooner that money is going to go towards something that you want to put that to, or something that you enjoy. And that's something that physical therapists really kind of, I've seen with my classmates, is that they've really struggled with student loans afterwards. So do a lot of research and finding that school that has opportunities for scholarships, and then also look for some of those extra ways to make money outside of school, working if you can during school, or getting extra hours outside of work when you're done with school, like PRN jobs, to really pay off student loans faster. So those are my pieces of advice. Choosing the area you're passionate about, evaluating the culture of your work, remembering how many people that you want to see per day, prioritize your self-care, and pay off those student loans. So as always, if you do have more questions, leave an answer, or leave a question in the Q&A section for the discussion module, or send an email. And I hope that you have enjoyed taking the Introduction to Physical Therapy class. I hope that has helped you to see if that's a career path you want to go into, or help you to find something that you want to choose outside of that profession. So take care, and I hope you enjoy the rest of this course.